How can gyms reopen safely? Here's what health experts say. In March, gyms and fitness studios closed due to the coronavirus. But now some states are looking to relax guidelines, which raises the question, how can gyms reopen safely? In the U.S. guidelines for reopening America released in mid-April, gyms, along with movie theaters, houses of worship, and sit-down dining, are listed as part of Phase 1 in the three-part reopening plan, with the stipulation that they must adhere to strict physical distancing and sanitation protocols in order to operate. There was no set date on when these phases would start, rather, it's up to states and local officials. They'll be using criteria like a 14-day downward trajectory of COVID-19 cases, hospital availability, and whether or not there's robust testing in place for at-risk workers in their area to determine whether or not they've reached those phase benchmarks. Following the release of those guidelines, some states have quickly moved forward with plans to reopen gyms. Georgia allowed gyms and fitness studios to open back up on April 24, as long as they followed procedures for social distancing and sanitation. Other states, like Arkansas, Oklahoma, and Wyoming, soon followed. Texas will be up next. They're allowing their gyms to reopen on May 18, at 25% capacity, and with other stipulations involving hand hygiene, sickness screening for employees, and social distancing requirements. The picture is less clear for gyms in other areas, especially in hard-hit states like New York, New Jersey, Massachusetts, and Pennsylvania. What is obvious, though, is that when gyms reopen across the country, they will look a whole lot different than they did just a few months ago. Gyms are going to have to come up with a robust plan for how they are going to keep their patrons safe. Amesh Adalja, MD, a senior scholar at the Johns Hopkins University Center for Health Security and Infectious Disease expert, tells Self. And it's likely going to be different for the foreseeable future, until we have a clear medication or clear vaccination available, says Waleed Javaid, MD, the Director of Infection Prevention and Control at Mount Sinai Downtown in New York. But what exactly would need to be done for gyms to reopen safely during the coronavirus pandemic? Unfortunately, like many questions with the coronavirus, there's no clear-cut, one-size-fits-all answer. There are a lot of gray areas with it, says Dr. Adalja. When your gym reopens, should you go back right away? Here's the bottom line, it's all going to come down to your personal risk preference, and how much of a risk you want to take to get back to the gym, says Dr. Adalja. In the time of the coronavirus, going to any public place, including gyms, will not be risk-free. And that's something you'll have to be okay with if you do decide to go back. The best thing you can do, then, is twofold: stay informed with what your gym is doing, inquire about what particular measures your gym is enacting, and see how they fit with the experts' advice below, and ask yourself how much of a risk you're okay with taking. And as Dr. Javaid said, you also have to weigh your reasons for going to the gym, to help you determine whether the benefits of going will outweigh the possibility of getting sick, or spreading the virus to others. Is it necessary? Is it vital? Is it worth the risk? He says. Know too that the science on the coronavirus is constantly changing, and new discoveries might affect earlier recommendations, and safety policies put in place. For instance, official recommendation for social distancing uses 6 feet as the benchmark, but some newer research suggests transmission may occur at greater distances. One study in emerging infectious diseases even suggested transmission may occur up to 13 feet away in a hospital setting. Whatever your answer, make sure you choose the path you're most comfortable with. If you're still on the fence, there's no need to rush to make a decision either way, and your thoughts may change as the pandemic progresses, so give yourself the mental leeway to shift as needed to make the right choice for you. What do health experts think should be done for gyms to reopen safely? Self connected with a few health experts to get some of the varying viewpoints to help you make your own decision about whether or not you should go back when your gym reopens in your area. We spoke with Dr. Adalja, Dr. Javaid, and Chad Petit, Ph.D., an assistant professor in the Department of Biochemistry and Molecular Genetics who researches coronaviruses at the University of Alabama at Birmingham, to find out what we need to know about getting back to the gym safely. Responses have been edited for clarity and length. Self, what's the greatest concern when it comes to gyms and fitness studios reopening? CP, gyms are typically places where it is very difficult to socially distance yourself. Some people work out with partners or have trainers, which would prohibit proper social distancing. The CDC also recommends the use of face coverings or masks to slow the spread of the virus, and many states and companies are adopting measures that require masks to be worn in public or in their places of business. The recommended use of masks may make it more difficult to exercise comfortably. WJ, when we look at the gym, the machines and all that are usually kept close by each other, especially in New York City because of space constraints. The other thing is, most of the recommendations for social distancing are based on our usual breathing patterns, that our droplets won't go beyond 6 feet, but when the person is breathing heavily when they are exercising, the spread might be even more. We don't know that for sure, but those are possibilities that might come back and create more problems. Self, what measures would gyms have to take to maintain social distancing? AA, they would need to think, do they have to space their machines farther apart? Are they 6 feet apart? Is that something they want to do? The same is true in the locker room. Are they going to want to limit the number of people who are going to be in the locker room? Are they going to close off some of the lockers so people have more space between them? Those are types of things you would look at. WJ, gyms need to make sure that things are more than 6 feet apart. And because people are moving substantially in a gym, from one machine to another, the pathways should be clearly marked every 6 feet so people know what's a safe distance. CP, current distancing guidelines require staying 6 feet away from other people in all directions. This would be difficult to achieve with current machine placement, unless there were policies implemented that staggered machine usage to satisfy the distances that need to be kept. This would also require monitoring by gym staff to ensure that these policies were followed. Given typical locker room layouts, it's difficult to imagine how social distancing guidelines could be followed without a number of restrictions limiting the number of people using them at any given time. This would also require gym staff to monitor the locker rooms to ensure people were adhering to any policies put into place. Self, how do you think gyms' cleaning procedures may need to change? AA, they may need to be more vigilant about it. Most gyms in the past usually relied on the members to clean down the equipment after they had been used, but they may now have a designated person to do that to ensure that it's being done with a certain amount of rigor. WJ, gyms should use disinfectants that have properties that kill coronavirus. A list of those is available on the EPA website. And using it reasonably frequently is going to be important. Before I get on a treadmill, I should be required to wipe it down with a disinfectant. Then, when I'm done with the machine, I should disinfect it again. And if you have that requirement, then you need to have a wipe there or whatever kind of disinfectant you're going to use. CP, in order to maintain social distancing, there would also need to be an abundance of cleaning supplies available throughout the gym. This would alleviate any issues with people having to gather or wait around a centralized location to have access to cleaning supplies. Self, what policies would gyms have to change to reopen safely? AA, I think many gyms will probably look at occupancy limits, to see how many people can safely be in the gym. They may do temperature checks, but I think there is mixed data on how effective they are. Not everyone who gets infected has a fever, and people can take Tylenol to suppress the fever. It's not ironclad, but there are places that do that. With masks, I think people may have difficulty exercising at peak performance if they are wearing a mask, so I think they have to make a decision on that. It might make it harder, make it more uncomfortable, to exercise when people feel constrained in their breathing when they are exerting themselves at the level they do during exercise. WJ, gyms as a whole should have policies and processes to make sure nobody who is ill is coming to exercise. I think people who have tested positive or were presumed positive with COVID-19 and who are not currently positive would need to have some sort of clearance from somebody like their primary care doctor, or the gym can have some sort of assessment done. As for masks, for as long as gym members can wear a mask, they should. Editor's note, because the coronavirus can be transmitted by people who are asymptomatic or pre-symptomatic, it's important to point out that until there's widespread testing in place, measures intended to screen people would likely not be fully adequate. In other words, there would still be a risk of asymptomatic or pre-symptomatic carriers, even if people with symptoms were not allowed in the gym. Self, what would need to be done for fitness classes to resume? I think it's the same principle, making sure people have enough distance between one another, making sure the common touch areas are cleaned frequently, and just advising people to wash their hands as much as possible. Some classes are harder to do that, so maybe they will remain virtual. All of them would require some sort of social distancing, some sort of indication of people who are ill, like self-reporting by the membership. Like, if I'm ill, am I required to let my Zumba teacher know that I'm ill or that I'm feeling well? Fitness classes would have to implement the same guidelines as the gym. However, I think there could be an opportunity to have these classes outside, where social distancing and other safety measures could be more easily adapted. How can gyms make sure they're keeping their staff and personal trainers safe? With personal training, you don't have to necessarily touch the person, so there are ways around that. And if people are doing hand hygiene and trying to stay 6 feet apart when trying to do the personal training, which could be done, that could make it safer. But again, this is not black and white. I think with one-on-one training, can it be done 6 feet apart? If you are getting closer than that, it becomes more of a medical-grade exposure, then you start needing higher-grade filtration for your mask, you require a gown and gloves. And all those things require training, and not everyone has training. Even wearing the simple gown or gloves is not a simple task. So it might be better not to come to a situation like that, at least not in the foreseeable future. See cheeky smiley face. Measures would need to be taken to keep people 6 feet apart from one another. I know that people have gotten creative and started doing training sessions using FaceTime or other digital means. What do you think patrons need to know when weighing their options on whether they should return or wait? These are all risk perception issues, and they're going to be different for each person. If you are a 65-year-old with diabetes, you are going to approach the gym in a very different way than a 22-year-old with no other medical problems. You just have to be aware of the fact that you have to do hand hygiene and that there may be sick people you are going to be exposed to. There is not a specific thing you have to do other than what you normally do to prevent illness. I think they need to evaluate the situation based on their current conditions. Do I have medical conditions that put me at higher risk in a situation like this? A second question would be, do I have a specific need to go to the gym? Is it necessary? Is it important enough to risk getting COVID? Because regardless of all precautions people take for COVID in the gym, a person can also get exposed en route to the gym. Getting out, getting exposed to other people, can also create more risk. See cheeky smiley face. Personally, I would want to know if my local gym was implementing policies and procedures that minimize risk and maximize safety. This would include understanding how they were ensuring social distancing, what cleaning and sanitizing procedures they adapted, etc. So what are gyms doing to keep their members safe? Since there are no overarching federal guidelines governing how gyms will reopen, all guidance will be specified by states, and if those rules are not concrete enough, it'll fall to the gyms themselves to put more specific policies in place. Many gyms have already created policies to make their space safer for members when they do reopen. We have created a comprehensive, phased reopening plan with extensive sanitation, safety and physical distancing protocols for our company-owned gyms, and have provided our guidelines and recommendations to our franchisees, Gold's Gym President and CEO Adam Zaitsev said in a statement to Self. Because exercise is a key element of staying healthy, we are eager to reopen our doors and welcome our members back into our gyms as soon as we are able. For Golds, this includes things like modified operating hours, including an intermission from 1 p.m. to 2 p.m., during which staff will conduct a full gym cleaning, a new code of conduct for members emphasizing cleaning standards and social distancing, staggered cardio and strength machines, and a mask and gloves requirement for staff. Equinox will be requiring members to book an appointment to enter the club, and they'll offer scanless check-ins through their app to minimize contact with staff, according to a statement sent to Self. Members also must complete a health declaration before each visit to confirm they have not been experiencing COVID-19 symptoms or come into contact with anyone who has. Plus, the disinfectants they use will all come from the EPA-sanctioned list. At SoulCycle, all staff members and instructors will have their temperature checked before their shift, bikes will be booked to maintain social distancing, and staff will use disinfectant to clean areas like bikes, weights, and other common touch surfaces after every class, as well as give their studios a full cleaning twice as often per week, according to a statement sent to Self. Lifetime will be spacing out its lockers, showers, and equipment, instituting several cleaning stations throughout the floor, and capping class capacity and reserving floor space to maintain social distancing there, according to its website. Personal trainers will practice social distancing, touch will be eliminated, and masks will be encouraged or required.